Most seniors trust that the medications prescribed to them are both necessary and safe, often assuming that because their doctor recommended it, the pill must be helping rather than harming. But what if that trust is being quietly betrayed? Not out of malice, but out of habit, outdated protocols, and the relentless push of pharmaceutical marketing. Every year, more than one-third of adults over 70 experience an adverse drug event, many of which are preventable, and too often, these reactions go unrecognized as being caused by the medications themselves. Instead, they're written off as just signs of aging, progression of disease, or unfortunate coincidences. But what most people don't realize is that certain medications, even ones considered routine or benign, can wreak havoc on an older body that processes drugs differently than a younger one. After age 70, the kidneys and liver are no longer as efficient at filtering and metabolizing drugs. Muscle mass decreases, fat stores shift, and even brain chemistry changes, meaning that a dosage considered standard for a middle-aged adult can cause toxicity, confusion, falls, or even hospitalization in a senior. What's worse, many of these medications are prescribed not by one single doctor, but by multiple providers who may not be fully aware of each other's decisions, leading to dangerous drug interactions and overmedication. In fact, 1 in 5 seniors takes 5 or more prescriptions, a condition known as polypharmacy, which dramatically increases the risk of drug side effects, cognitive decline, falls, and even death. That's why more geriatric experts are now urgently speaking out, calling for a complete reevaluation of what medications we give to our elders and why. And among the most concerning are 7 specific types of medications that have quietly become some of the most dangerous for seniors over 70. These aren't rare, experimental drugs. They're commonly prescribed pills, many of which are sitting in medicine cabinets across the country right now. Some are used to treat anxiety, pain, or high blood pressure, while others are aimed at insomnia, depression, or acid reflux. The problem isn't just the medication itself, but how the aging body reacts to it, and how those reactions can mimic or accelerate the very conditions we're trying to prevent, like dementia, frailty, or chronic fatigue. The first medication category that has raised widespread concern among geriatric specialists is benzodiazepines. Drugs like diazepam, Valium, lorazepam, Ativan, and alprazolam, Xanax. Often prescribed for anxiety or sleep, these medications are known for their sedating effects. But in seniors, they can lead to severe confusion, impaired coordination, slowed breathing, and a much higher risk of falling. Many seniors report feeling off, groggy, or forgetful while on these drugs, and family members may notice a sudden decline in memory or alertness. Yet instead of recognizing it as a side effect, doctors may misdiagnose it as early dementia and respond by adding even more medications, further worsening the problem. The second concerning class includes anticholinergic medications, which block the action of acetylcholine, a neurotransmitter vital for memory and cognition. These drugs are found in a wide range of treatments, from bladder control pills like oxybutynin to over-the-counter sleep aids like diphenhydramine, Benadryl, or certain antidepressants like amitriptyline. Anticholinergics have been repeatedly linked to memory loss, confusion, constipation, dry mouth, and even increased risk of Alzheimer's disease when used long-term. Unfortunately, many seniors are prescribed multiple drugs with anticholinergic properties at once, compounding their cognitive effects. Despite being flagged in the American Geriatric Society's Beers criteria, a guide listing potentially inappropriate medications for older adults, these drugs are still widely used, often without proper monitoring. And for a senior already struggling with mild cognitive issues or balance problems, the addition of anticholinergics can tip the scale into dangerous territory. Another major concern is opioid painkillers. While these may be appropriate in short bursts for severe pain, long-term use in older adults can cause profound sedation, respiratory suppression, and falls. But even more insidious is the way opioids impact hormones and mood. Seniors on chronic opioids often experience depression, low testosterone, poor appetite, and disrupted sleep, all of which are frequently misattributed to aging or unrelated illness. Add in the risk of dependency, and it becomes clear why opioids, while sometimes necessary, must be used with extreme caution in older populations. Yet many seniors receive long-term prescriptions for back pain, arthritis, or nerve issues without being offered safer alternatives. These are just a few examples of how routine medications can become silent threats in aging bodies. In the coming segments, we'll uncover even more of these hidden dangers, including drugs commonly prescribed for high blood pressure, acid reflux, and insomnia, that can slowly erode a senior's quality of life without them even realizing the cause. If you or someone you love is over 70 and taking multiple medications, especially from different doctors or providers, now is the time to become informed, vigilant, and proactive. Because the cost of staying silent or blindly trusting that every prescription is safe can be far greater than most people imagine. Continuing from the silent dangers already discussed, one cannot ignore the fourth category of medications that are quietly sabotaging the health of millions of seniors. Proton pump inhibitors, PPIs, such as omeprazole, Prilosec, esomeprazole, Nexium, and lansoprazole, Prevacid, which are commonly prescribed for acid reflux or GERD. While these drugs are incredibly effective at reducing stomach acid, they are often prescribed indefinitely without routine reassessment. In older adults, long-term use of PPIs has been associated with an alarming array of serious side effects, including an increased risk of chronic kidney disease, nutrient malabsorption, particularly vitamin B12, magnesium, and calcium, bone fractures due to weakened bones, and even dementia. The suppression of stomach acid, which is necessary for proper digestion and defense against harmful bacteria, creates a cascade of unintended consequences. Seniors who take PPIs for extended periods may begin to suffer from fatigue, confusion, brittle bones, and gastrointestinal infections, all of which may be misattributed to normal aging or unrelated illnesses, when in fact their acid-suppressing medication could be the root cause. Even more troubling is that many seniors continue using PPIs long after the initial cause of reflux is resolved, and often at higher than necessary doses, simply because no doctor has taken the time to reevaluate the prescription. The fifth medication on this list, though often viewed as a mild remedy, hides behind a seemingly innocent label: over-the-counter sleep aids and antihistamines, especially those containing diphenhydramine, like Benadryl, Tylenol PM, and Nytol. These medications carry strong anticholinergic properties, which, as previously mentioned, can have profound negative effects on brain function, memory, and alertness in the elderly. Many seniors turn to these medications when sleep becomes elusive, a common challenge with aging. But the cost of temporary sedation is long-term cognitive impairment. Worse still, the grogginess they create doesn't just end in the morning. It lingers into the day, slowing reaction time, impairing judgment, and drastically increasing fall risk. Many hospitalizations for hip fractures or head trauma in seniors are directly linked to nighttime use of over-the-counter sedatives. Yet these medications remain readily accessible without warning labels or age-related usage guidelines. Families often don't connect the dots between grandma's confusion and the PM pill she took before bed, or the sudden increase in falls and the antihistamine used to help with seasonal allergies. But geriatric physicians see the pattern over and over, and it's why these medications are high on every senior health warning list. Moving to number 6, we encounter antipsychotic medications, such as risperidone, Risperdal, quetiapine, Seroquel, and olanzapine, Zyprexa, which are sometimes prescribed to manage behavioral symptoms in seniors with dementia or even for sleep or anxiety. However, their use in older adults, especially those with cognitive decline, is fraught with danger. Antipsychotics carry a black box warning due to their association with an increased risk of death in elderly dementia patients. Beyond that, these medications often induce extreme drowsiness, muscle stiffness, tremors, and a condition called tardive dyskinesia, which involves involuntary muscle movements that may become permanent. These drugs can dull a senior's personality, making them appear vacant, lethargic, or emotionally flat, a devastating outcome when quality of life is already under strain. While in certain extreme situations their use may be justified for safety or severe agitation, too often they are prescribed as chemical restraints to manage behaviors that could be better handled through compassionate care, structured environments, and support. Families may not realize that their loved one's decline is not purely from dementia, but is being accelerated by the very medication given to calm them. And finally, we reach the seventh, and perhaps most dangerously overlooked category of medications: blood pressure medications, particularly those that are too potent or not adjusted for an elderly person's physiology. While controlling blood pressure is critical for preventing stroke and heart disease, overtreatment can lead to blood pressure that is too low, resulting in dizziness, lightheadedness, fainting, and falls. Medications such as alpha blockers, like doxazosin, or central-acting agents, like clonidine, are especially risky in older adults. As the body ages, its ability to regulate blood pressure, especially when changing positions, diminishes. Seniors often experience orthostatic hypotension, a sudden drop in blood pressure when standing, which can lead to blackouts, fractures, and head injuries. And when a doctor aggressively lowers blood pressure targets in an older patient based on outdated guidelines, it can backfire catastrophically. Moreover, the combination of multiple blood pressure drugs, common in seniors trying to meet arbitrary ideal numbers, only compounds these risks. Seniors frequently report feeling weak, unsteady, or mentally foggy, but attribute it to just getting old, not realizing that their medications may be contributing significantly. In fact, some experts argue that for seniors over 70, a slightly higher blood pressure may be protective, especially when frailty or existing cognitive issues are present. Yet, the pressure to hit textbook targets persists, often leading to overmedication. When you put all 7 of these medication classes together, benzodiazepines, anticholinergics, opioids, PPIs, over-the-counter sleep aids, antipsychotics, and aggressive blood pressure drugs, you see a troubling pattern emerge. These are not fringe treatments. They are mainstream, frequently used, and too often unquestioned. And they may be slowly and silently robbing older adults of their vitality, mobility, memory, and independence. It's not uncommon for a senior to begin taking one of these drugs and experience subtle changes: slower thinking, weaker balance, more frequent naps, or digestive discomfort, none of which are immediately traced back to the prescription. Doctors may even respond by prescribing additional drugs to treat the side effects, creating a vicious cycle of polypharmacy and dependency. That's why it's more critical than ever for seniors and their families to take an active role in reviewing all medications regularly, asking hard questions, and pushing for deprescribing when appropriate. Coming up, we'll explore real-life stories of seniors who reclaimed their health by reducing or eliminating dangerous prescriptions, along with step-by-step guidance for how to safely review and manage medications with your doctor. Because knowledge is power, and in this case, it could be the power to save a life or add vibrant, independent years to someone's future. Now that we've covered the medication classes posing the greatest risk, it's important to understand why seniors are so vulnerable to these dangers and what systemic factors contribute to this crisis. The issue is far from simple and is deeply rooted in how healthcare systems, doctors, and even society approach aging in medicine. First, aging itself changes how the body processes drugs, known as pharmacokinetics and pharmacodynamics, And this means medications that were safe or effective in younger adults can behave very differently in older individuals. Kidney and liver functions decline with age, reducing the body's ability to clear drugs efficiently, which lead to higher blood levels and prolonged exposure to side effects. The brain becomes more sensitive to medications affecting neurotransmitters, making cognitive and motor impairments more likely. Even the gut's absorption and metabolism change, affecting how much of a drug enters the bloodstream. But despite these known physiological changes, many medications prescribed to seniors remain at doses developed for younger adults, without enough individualization or adjustment. Second, the very complexity of managing multiple chronic diseases creates a perfect storm for medication overload. Many seniors suffer from a constellation of conditions: arthritis, hypertension, diabetes, sleep disorders, depression, acid reflux, and each diagnosis often triggers a new prescription. Guidelines for single diseases often do not account for the interplay of other conditions, resulting in polypharmacy, where a senior may be taking 5, 10, or even more medications daily. Each new drug increases the risk of harmful interactions and side effects. But physicians may feel pressured to follow clinical protocols without a holistic view or the time to do a thorough medication review. Third, the fragmented nature of healthcare exacerbates the problem. Seniors often see multiple specialists, cardiologists, endocrinologists, psychiatrists, each focused on their specialty and unaware of the full medication regimen prescribed by others. Without strong communication and coordination, duplicate drugs, contraindicated combinations, or risky interactions slip through the cracks. Primary care physicians, often overwhelmed by high patient loads, may not have enough time to carefully evaluate each medication's necessity or to prescribe when appropriate. Fourth, the fear of undertreatment or litigation pushes doctors to maintain or add medications just in case, leading to a culture of defensive medicine. Many seniors feel reluctant to question their prescriptions, trusting that more medication means better care, unaware of the subtle but dangerous side effects accumulating daily. But the reality is that more medication often means more harm. This paradox highlights the crucial role of medication reconciliation, where all medications, prescription, over-the-counter, and supplements are reviewed regularly to identify and eliminate unnecessary or harmful drugs. Studies show that deprescribing interventions, when done carefully and collaboratively with the patient, can improve cognition, reduce falls, and enhance quality of life without compromising disease control. However, this process requires time, patience, and patient education, which is often lacking in routine visits. Fifth, family members and caregivers must become advocates and active participants in medication management. They are often the first to notice subtle changes in mood, balance, or alertness, which might be mistakenly attributed to just aging. Encouraging open dialogue with healthcare providers, requesting medication reviews, and asking about alternatives or lower doses can make a life-saving difference. Simple questions like, is this medication still necessary? Or can we try stopping this drug to see if it helps? Can open the door to safer treatment plans. Sixth, lifestyle and non-pharmacological approaches should be prioritized wherever possible to reduce reliance on risky medications. For instance, pain management can benefit greatly from physical therapy, gentle exercise, acupuncture, or mindfulness techniques, rather than defaulting to opioids or benzodiazepines. Sleep hygiene practices, relaxation exercises, or cognitive behavioral therapy for insomnia can be more effective and safer than sedative sleep aids. Nutritional counseling and regular monitoring can sometimes alleviate symptoms that otherwise prompt medication prescriptions. Finally, seniors themselves need empowerment through education about their medications. Understanding what each drug does, possible side effects, and warning signs to watch for builds confidence to question and collaborate on treatment decisions. Medication lists should be kept up to date and brought to every medical appointment. Apps or pill organizers can assist with adherence, but the goal is always to minimize the number of medications needed while maximizing health and independence. This is the essence of geriatric prescribing. Start low, go slow, and regularly reassess. In summary, while the 7 classes of medications we discussed are among the most dangerous for seniors over 70, the solution is not simply to avoid all these drugs outright. Instead, a thoughtful, individualized approach is needed. One that balances benefits and risks, prioritizes non-drug therapies, involves caregivers, and demands regular review and deprescribing when possible. By becoming informed, vigilant, and proactive, seniors and their families can break free from the cycle of harmful polypharmacy and reclaim health, vitality, and quality of life. Coming up next, we will dive into powerful real-life success stories of seniors who reduced their medication burden and experienced remarkable improvements in memory, mobility, and overall well-being, along with practical steps you can take right now to start this journey safely and effectively. As we reach the final part of this vital topic, it's time to bring everything together with the real-world implications, the uplifting outcomes that happen when seniors, caregivers, and doctors take these medication risks seriously, and the actionable plan that anyone watching can begin following tonight. Across the world, countless seniors have unknowingly lived in a fog created by unnecessary or dangerous medications, confused, fatigued, off balance, or just not feeling like themselves. One powerful case comes from a 78-year-old grandmother named Doris, who was taking over 12 different medications for blood pressure, anxiety, cholesterol, pain, and sleep. Her family noticed she was becoming withdrawn, forgetful, and had fallen twice within a few months. At first, they feared early dementia, but a geriatric pharmacist reviewed her medications and identified 3 serious interactions, including a benzodiazepine and an anticholinergic that were impairing her cognition. With her doctor's guidance, these were safely tapered and removed, replaced with lifestyle modifications and low-risk alternatives. Within 6 weeks, Doris was smiling, holding conversations again, and walking with more confidence than she had in years. Her transformation wasn't miraculous. It was just a clear example of what happens when medication risks are confronted head-on. Her story echoes across thousands of seniors whose symptoms once thought to be signs of aging were actually side effects hiding in plain sight. The key takeaway is that reversing the damage caused by inappropriate medications is not only possible, but often surprisingly fast when action is taken. So what can you or your loved ones do today? First, create a complete and accurate list of every medication and supplement being taken. Don't rely on memory. Write it down or use a medication management app. Second, schedule a dedicated appointment with your primary care doctor, specifically to review this list and ask whether each drug is still necessary, if safer alternatives exist, or whether tapering or deprescribing might be possible. Third, be alert for symptoms commonly caused by medication side effects, such as memory problems, drowsiness, dizziness, dry mouth, constipation, confusion, tremors, or blurred vision, and don't dismiss them as just aging. Fourth, get a second opinion from a geriatric specialist or pharmacist if your medication list exceeds 5 drugs. Fifth, shift toward lifestyle strategies whenever possible. Gentle exercise like walking, tai chi, stretching, or resistance bands for pain and balance. Calming bedtime routines for sleep. DASH or Mediterranean-style diets for blood pressure and cholesterol. Breathing exercises and social support for anxiety and mood, and cognitive engagement activities to reduce dependence on medications for mental sharpness. Sixth, educate yourself continuously. Learn about medications, their classes, potential risks, and alternative therapies. Even a few hours of research or asking the right questions can drastically change your health journey. Seventh, involve your family. Let them know the risks you face. Share your medication list with someone you trust, and ask for help watching for changes in mood, memory, or coordination. Lastly, Cultivate the courage to advocate for yourself. Ask doctors directly, is this medication right for me in my age? Or could this be causing my fatigue or brain fog? These questions could be the turning point that spares you years of avoidable suffering. Remember, this video wasn't meant to scare you, but to empower you with the truth that even though doctors once saw these medications as helpful, modern science has revealed how dangerous they can be when not carefully managed in older adults. You have more control than you think. You deserve clarity, energy, and comfort in your golden years, not confusion, weakness, or daily fear of falling. And the first step starts with awareness. By watching this video and absorbing its message, you've already taken a powerful step forward. Don't let this be just another health video you watch and forget. Take action today. Print your medication list, call your doctor, start the conversation, and reclaim your health. If you know someone over 70 who's on multiple medications, share this video. It could be the wake-up call that changes their life. Because at the end of the day, medications are tools, not solutions in themselves. And when they begin doing more harm than good, it's time to reassess, rebalance, and reimagine a better, safer path to wellness. You got this. And we're here to guide you every step of the way.